My fire for working with endometriosis began because it took me 23 years to be diagnosed with endometriosis. And that was someone who had access to anything in healthcare, as well as I had an entire family in medicine. And
Mm.
still, I waited so long to be diagnosed that I had significantly advanced disease. And so I felt that if that could happen to me, that I wanted to take my license and make sure it didn't happen to someone else.
Hi there, and welcome back to the Integrative Women's Health Podcast. I'm your host, Dr. Jessica Drummond, and I'm so excited to introduce you to Dr. Sallie Sarrel. She, as you well know, is a licensed physical therapist and has really pushed forward the field of endometriosis. Welcome, Sallie. I want to start by diving into your story and what have you done, and what is like the fire behind your passion for helping women with endometriosis?
Thank you so much for having me. It's a pleasure to be here. My fire for working with endometriosis began because it took me 23 years to be diagnosed with endometriosis. And that was someone who had access to anything in healthcare, as well as I had an entire family in medicine. And
Mm.
still, I waited so long to be diagnosed that I had significantly advanced disease. And so I felt that if that could happen to me, that I wanted to take my license and make sure it didn't happen to someone else. Also, I would have surgery, and surgery would help, but it didn't fix everything in me, and I would still have pain. I would definitely have trouble recouping after surgery. And one of the things that really helped me was the pelvic PT that I was doing. And of course, I'm fairly active, and I always wanted to return to sport. And when you have surgery, you can't just go do whatever. And of course, it comes out later on down the road. I have a connective tissue disorder, and you have to really optimize your system. And so, first, I had a physical therapy practice where I worked with people one on one, and I developed techniques as well as research in the field of physical therapy to make sure that we associate endometriosis with using physical therapy. But
Mhm.
then physical therapy is not really enough. We have to do more to optimize our system. We need to be making sure we're getting the right mental health care. We need to, it's coming out more and more, optimize our gut. For those of us in the connective tissue world, optimize your tissue. And I wanted to make sure everybody understood that it's a multidisciplinary approach. So I looked at Dr. Andrea Vidali one day. We were standing in the OR, and I said, like, patients should know that good surgery matters, but a lot of other things matter. And look, maybe he didn't want to say this, but he out of his mouth falls the word, yeah, we should have like a meeting.
Mhm.
And that's how the Endometriosis Summit got started. And when we first started it, the hospital donated the room that we were going to have this meeting in, and it only held 35 people.
Mhm.
And the first year we had close to 300 people. So that room didn't work out. And
Yeah.
now between in person and online, we host close to 600 people.
Yeah.
But our goal is to push the envelope of what's being offered out there. Because if change is to come in endometriosis, it has to come from either the people with the disease or the people working in the disease. We can't just accept what's handed to us anymore. And then the other goal is to make sure that people understand surgery is not one and done.
Mhm.
Your system has been through a war, and we have to clean that up quite a bit.
Yeah. Yeah. And I think really one of the things I love so much about your summit, having spoken there, years ago, really, and several times since then, was your invitation to those of us thinking about the gut microbiome and the immune system and hormone impacts of endometriosis and constipation and musculoskeletal. And so that true interdisciplinary perspective, And actually, the most important piece of that, especially from those of us with a health coaching standpoint, was that you always had a sort of equal collaboration of people living with endometriosis who didn't necessarily have clinical degrees or licensures or were not wellness professionals. They were patients who might have any other kind of job. And then, of course, what's been so interesting to me over the last few years is all of us in healthcare are also humans, patients. Like there's this sort of artificial divide between people living with complex chronic illnesses, which is growing every day, including endometriosis, and people who work in the field. A lot of times that there's an overlap, as in your case. So hearing the voice of someone managing this in their day-to-day life as being equal to the top surgeon or whatever, which, in conventional medicine, there's sort of such a strong history of hierarchy. You really leveled that playing field from the first time you and Dr. Vidali, launched the Endometriosis Summit.
Yeah, I don't believe that it should be nothing for us without us.
Mm-hmm.
And that's how endometriosis should be treated. And ultimately, endometriosis is unique in that the people who have the disease or work one-on-one for, a doctor sometimes only gets 20 minutes, but a health coach, a physical therapist, certain nutritionists, they get hours with the patient.
Mm-hmm.
And they get to hear what the disease is really like. And so we can't push the disease forward without the actual personal narrative of those with the disease. And a good example of this is what's coming out now about the connections between connective tissue dysfunction, so mast cell dysautonomia, not always EDS, but on that spectrum, and endometriosis. And I don't think if the patients hadn't pushed and started to challenge, but why am I having all these surgeries? Why is hernia a comorbidity with endometriosis? We never would have started to look into that connection. And I'm seeing that more and more. Every year, that's the number one thing people ask us to look at. That and menopause. It's very tricky, menopause.
No, absolutely. I've been asking all of my clients with endometriosis in the last few years because that's one of the most interesting things about, my own recent history with long COVID triggered mast cell activation syndrome, dysautonomia, hypermobility, which I may or may not have always had, but I was always strong enough to be able to exercise to sort of maintain it. And I've been asking my clients with endometriosis about their experience of that. And I would say 100% in the last year of if I say something like, do you have any symptoms related to hyperflexibility? Were you in dance as a child? Like, was this something that was always a part of your life? How about rashes and hives and, passing out a lot when you were a kid, like these kind of maybe not fully clinical diagnoses of dysautonomia, hypermobility, or MCAS, but tendencies toward that. I absolutely see that connection with endometriosis. And so it becomes even more complicated in an environment of increasing post-viral syndrome and more toxicity. So I'm sure we're going to see that more and more.
Yes. Well, one thing that's interesting is the conference is now held in Florida, even though we are a year-round entity that work nonstop. But because it's in Florida, it's very humid here.
Yeah.
And we see people being more open and honest with the POTS and the dysautonomia than we ever saw in New York, because I think in New York, people just think like it's a bad day. Whereas here, you have to be able to like cope a day in, day out, 6 months of the year, 95 degrees, and your shirt is soaked through.
Yeah.
And it's amazing how, I think that's really amazing. I also had a very interesting conversation about the way the mast cell, this was Friday. I'll probably butcher this, but
That's okay.
the way the mast cell works, a lot of people with endometriosis, and I almost could say the same thing, that I had cramps from the very beginning, but I was coping with it. And then I had like a trigger
Mhm.
And my food allergies came. I have redder skin, which I cover usually with suntan lotion. But and that the issue became there is on the mast cell spectrum. It's that one thing that triggers the
Yeah.
inflammatory response. So the endometriosis was probably there,
Yeah.
but it wasn't inflamed and taking a hold of my life until I had the trigger.
Well, I think that's very true. And what I'm seeing even more and more, like through that lens of, we used to talk about the terrible triplets of vulvodynia and bladder pain syndrome and endometriosis, which of course still does exist. But I think deeper to that is what we've been trying to look at for the last couple of decades around immune dysregulation, which is that mast cell, that, kind of those genetic vulnerabilities, if you will, and now being exposed to a more stressful physical environment, whether it's more environmental toxins or, like you said, moving to a more humid environment where you might notice it more, or an environment with more mold toxicity, to finally a level where it triggers that activation. And I also think, as you mentioned briefly, a lot of conversation. I'm actually just about to release a podcast on endometriosis and perimenopause and menopause, because the research there, we used to think of endometriosis as this estrogen driven disease, right? And we know clearly it's just not that simple. But it used to be also the conversation that menopause and perimenopause is a cure for endometriosis, which of course it's not, just like all the other so-called cures out there. But that could even be another trigger for some of the more complex presentations and manifestations of endometriosis, that the experience of perimenopause and menopause. Have you seen much of that?
Well, we know that endometriosis, we know from pathology on the disease that endometriosis has receptors for both estrogen and progesterone.
Yeah.
And while it's not sensitive to testosterone, testosterone can go through a process that plays a role in estrogen as well. And so
Yeah.
the issue with what I believe menopause and endometriosis is that for years and years and years and years, people are told that endometriosis will be cured by menopause. And then you have basically 29 to 32-year-old women who are either put in surgical menopause or
Mm.
chemical menopause, and it doesn't provide any help.
Yeah.
And if you look at what's going on in menopause research right now, we're seeing menopause connected to Alzheimer's. We're seeing menopause connected to cardiac health. We're seeing menopause even connected, or lack of estrogen, certain types of estrogen connected to breast cancer as well. And
Mm-hmm.
we can't throw out the health of the person because they have this disease. And the other issue that we see is people are taught, well, endometriosis makes its own estrogen, so therefore you can't treat perimenopause or menopause. And it's really a problem. It's a problem for the Endometriosis Summit, because if we take one stance, then the whole world is like, it's a very patient to patient
Yeah.
stance, right?
Yes, for sure. For sure.
And that's my thing. I had a very hard time with menopause. I was 38 years old. And my biggest symptom, honestly, was the insulin resistance you get with menopause, which
Mm-hmm.
I can get to. Dr. Vidali is starting to see that quite a bit.
Mm-hmm. Absolutely.
Because don't forget, he works on the immune side with endometriosis. And it's torturous. It's torturous mentally, it's torturous physically. And to be told that your best bet is to eat a lot of broccoli, and that you can't, some people need to supplement. I was in that
Oh,
boat.
yeah.
And like, it's very hard for me, because I truly believe that if you're the person who needs to supplement, who needs the hormones, then you should get a clean excision and have the disease removed, and then use the hormones. But the rest of the world is not on board. But I
Mm.
have a family history of heart disease. I was getting insulin resistance. We have to empower people to live life beyond the disease. And there's some sort of, this is a conversation like that's ongoing. I'm interested to hear your podcast, because many in the industry don't want me to talk about menopause because I will throw a little wrench into this notion that women with endometriosis can never supplement with estrogen or
Mm,
progesterone. I don't think you should do only one, by the
right,
way.
right.
I'm the person that believes you need to do both, actually all three, but that's different.
Well, I completely agree with you. From our perspective and clinically, what we're starting to do and expand a lot more because of my underlying knowledge of the integration between the immune system, the gut microbiome, and the nervous system. We can't take the hormones as just like a silver bullet, right? There's not just
Right.
going to be one hormone prescription. That's almost the top of the mountain, if you will. Under that, first, we have to look at how is each individual woman with or without endometriosis metabolizing her hormones? Does she have constipation? Does she have liver issues before we layer on supportive supplemental hormones? And I completely agree with you in the sense that then individually, how is her cognition? How is her brain fog? How is her bone health? What is her family bone history and cancer history and all of those individual pieces, cardiovascular history? Then the right dose of the hormone, the right delivery system, the right combination of estrogen and progesterone and potentially testosterone if someone needs that personally. And what we've started looking at even more rigorously is the metabolic impact. So there's data on endometriosis that there is a GLP-1 deficiency in some women with endometriosis.
Dr. Vidali is obsessed, it puts it lightly,
Yeah.
on GLP-1s and the person with infertility, not just
Yep.
endometriosis.
Yep.
And any person with endometriosis who has been able to access the GLP-1s has said this is life altering, even if I'm not losing weight.
Yes.
And
100%.
so
Yeah.
clinically, we see that. It's amazing to hear about I can't wait for your podcast.
Yeah. So I'll go more into this I could go on for days about this, but I definitely think it's the exact same thing when we start thinking about GLP-1 peptide agonists. I've been taking tons of peptides since I've had long COVID, and it's a whole, the good thing about peptides is they are naturally occurring within the body. There are the particular FDA approved delivery of certain peptides, but we can do them at various doses in the same way that we think about hormones, right? Not everyone needs huge doses of hormones. Not everyone needs huge doses of GLP-1, but we have data that there are GLP-1 deficiencies in endometriosis. And then you combine that with perimenopause and menopause and or infertility and or PCOS. And there's a lot we can do nutritionally, like backing up to what you said in terms of broccoli and, broccoli supplements. Absolutely, we want people on nutrient dense, lower carbohydrate diets, but sometimes that's just not enough because of the environmental toxic load that we currently live in, or just the impracticality of eating perfectly, exercising perfectly, and what that can cause in someone with endometriosis or any woman, quite frankly, but certainly with endometriosis when food is painful in some cases is actually a path down eating disorder. So we absolutely, I'm obsessed, as is Dr. Vidali, around these tools because we can vary the dose, we can personalize it, and we have data that it makes intuitive sense. So back to like your work around this, I think that we do, and I understand your challenge with kind of the platform you have with the Endometriosis Summit and kind of any sort of one size fits all recommendation. But I think the more that practitioners can be educated in nuanced ways to utilize hormones and GLP-1 agonists for people with endometriosis, there's so many reasons, as you said, outside of the endo to optimize your health with these other tools.
Right. I also think that, and your coaches that are listening to, or physical therapists that are listening to, one of the issues in endometriosis is in the United States, it's different in certain countries,
Mm-hmm.
but the endometriosis surgeon is not only doing excision, which is a long and difficult thing. they're playing radiologist,
Mm-hmm.
they're playing immunologist, now they're evaluating for connective tissue disorders.
Mm-hmm.
And we're doing a lot of microbiome education, and they're now trying to do that, as well as they have to do, not as in depth as the physical therapist, but they have to do the pelvic floor and musculoskeletal examination.
Mm-hmm.
And I sat at this conference a couple weeks ago, and they were talking about how they don't see their children, but they can't do less on a case because then the person doesn't have a shot at all. And
Mm-hmm.
I think we're going to start seeing multidisciplinary centers arise that have a health coach, that have a physical therapist, that have certainly a urologist with endometriosis. You need to be working with that, but that have everything in-house, because the doctors, there's only probably 300 excisionists in the United States, and they can't do that on every single case and not be burnt out.
Absolutely. And I think that's an important thing to advocate for. Sometimes people are like, why isn't all of this happening? But the reality is, there aren't enough people with this knowledge. So everyone listening to this, who is a professional, who's a physical therapist, who's a functional nutritionist, who's a health coach, here's your opportunity to collaborate with these skilled surgeons so that they can stay focused on the piece of the puzzle that they need to focus on, which includes some of those things just for a better surgery. But the pre-op and post-op is the opportunity for everyone else in this field.
Yeah, I also think that there are certain trends emerging in endometriosis right now.
Mm-hmm.
And in order to treat those trends, you're either going to need very advanced training as a surgeon, or you're going to need to develop a team that works on them. So to me, those trends include microbiome.
Mm-hmm.
We had an incredible presentation by Shanti Moling, who is
Mm-hmm.
releasing research. And I'll just go so far. You should have her on the podcast because it was a very advanced scientific discussion on the microbiome. She'd be fabulous. I'll get you the video footage if you need it.
Great.
So I think the microbiome, and not just the gut microbiome, which I learned from you, the uterine and the vaginal microbiome, incredibly important. And we're working
Yeah.
with AUA as well. And so the bladder lining, the microbiome in the bladder, these are places where if there's inflammation that is not managed properly, you're going to feel like junk.
Yeah.
And so important. There's even a study, it's not like fantastic, about diagnosis of endometriosis through a microbe in the vaginal microbiome. It's very early stages.
Mm-hmm.
Of the biofilms in the bladder can
Mm-hmm.
be life altering for people. So I
Yeah.
think that's one area that's emerging. And what's nice is microbiome work is not surgical.
Right. Absolutely.
From even learning a movement diary every day. And I'm not saying I love to work out, you do
Mm-hmm.
too, but that's not what I'm saying. You can alter your microbiome by just doing something you love that is moving. Could be
Yeah.
dance.
Yeah. Absolutely. And dancing is actually one of the number one things you can do for your mental health, which
Yeah.
is also important. Yeah.
So I think that's one trend. And I think the biggest trend that I'm seeing is the emergence of what's called neuropelveology.
Mm.
And
Say more about that.
neuropelveology is developed by Passover. He's in Switzerland. And it's this science of, I would say, operating, but also identifying and evaluating the nerves and also the arteries and veins that may be affected not only by endometriosis, but by normal adhesions,
Mm-hmm.
things that we can get really from tripping over a curb, but that endometriosis creates this inflammatory process in or around. And it's mind blowing to see that type of work. And this year, when they did they do a big thing in St. Louis for it.
Mm-hmm.
Dr. Lemos does that. So a little different than Dr. Passover, but Dr. Passover trained him, I'm assuming.
Mm-hmm.
And they invited the PTs in for the first time.
Mm.
And who speaks nerve and dermatomes better than a physical therapist?
Yeah. For sure. For sure. And we know so much about, those of us in functional nutrition, functional medicine. We know so much about vagus toning. We know so much about the impact of that on vascular mobility, if you will, vascular flexibility, nitric oxide optimization. So I'm really excited to hear these trends because I feel like they're like a lot deeper science into all the practical stuff that we've been doing for almost 20 years now. And now we're seeing the real science of the impact on women, specifically with endometriosis and their symptoms.
Yeah, and I think, we're going to develop a lab
Mm-hmm.
for it, and I think it's something that doctors are going to need. They once you operate on this nerve, and these are deep, deep nerves in the pelvis,
Mm-hmm.
you can't just say, "Okay, bye bye, go home, lay in bed, watch TV," because you have to really do a very decent neural tensioning program. You have to it's very interesting work. And the other thing that I find fascinating is now the orthopedists are getting involved in this pelvic pain field, which we haven't seen in a long time.
Mm-hmm.
And there's a lot of things that the person with endometriosis will continue to go back from to the gynecologist for, but it's really neural issues that you have to reach by going through the hip or by working on the hip. I'm not
Mm-hmm.
talking about labrum tears. I'm not talking about a hip dislocation, things like that. I'm talking about work on the inferior gluteal arteries. Piriformis syndrome really isn't piriformis, by the way,
Mm.
And these things, I'm excited to see that after all these years that we beg for help for our pain, that the orthopedists are also getting on board.
Yeah, so talk about that just briefly. Like, what do you think the impact is of the fact that, you started the Endometriosis Summit, what, like 10, 12 years ago?
Oh, nice try, though.
Longer?
We're going to enter our 7th Endometriosis Summit, March 28th through the 30th, 2025.
Okay.
I've been practicing like you for close to 20 years. And these conversations that are something I cherish, right? This is how you advance the lives of people with the disease, are conversations like this.
Yeah,
No one was having these 20 years ago.
true.
I remember I met Amy Stein on a plane,
Mm-hmm.
right? Amy Stein, one of the most well-known physical therapists. And I met her on a plane. And first, I almost asked for her autograph because I had used heel pelvic pain when nobody knew what was wrong with me. All I did was the exercises in her book.
Oh, wow.
But I remember being on that plane with her was the first time in my entire career, and I was already probably 10 years into my career,
Mm-hmm.
I had ever met someone that understood what I was talking about
Wow.
on a plane. We met in security, and I was like, "Are you Amy Stein?" I am, and she's like, "Oh
Yeah.
my God, someone recognized me." But now we have groups, right? You have
Yeah.
your group and your team. We have podcasts. We have the GFAM. We have Pelvic Health Academy. We didn't have stuff like that years ago.
Yeah. And I think so. So if it's 7 years, amazing. What I do think the work that we're seeing, though, is the advancement is happening at an accelerated pace. And we briefly, before we started recording, we're talking about the such important work that Shannon Cohn is doing. And she's also on a previous episode of this podcast. The awareness and, quite frankly, the research dollars into this basic science research around nerves, vessels, integration with orthopedic structures of the hip, of the pelvic floor, and the integration of that with the bladder microbiome, the vulvovaginal microbiome, the uterine microbiome, the gut microbiome, and the nervous system. Quite frankly, honestly, until this conversation today, I've hardly ever, other than at the Endometriosis Summit, talk to very many people in the field who really are thinking that broadly. And so I want to commend you and Dr. Vidali, because I think you've really accelerated the complexity of these conversations. And thus, the research dollars are much more being directed in the right direction.
Well, I think hats off to Shannon Cohn and Endo. because one of the things, look, the people working in endometriosis that are making a difference, we all had the disease.
Mm-hmm.
And she was masterful in being able to make the disease, to make her story and everybody else's story personal.
Yeah.
So once the story was personal, we could realize it's a bipartisan issue,
Mm-hmm.
right?
Yeah.
This is not, has, although there are aspects that are partisan, but
Yeah.
it's a bipartisan issue. And she was able to increase national research funding for endometriosis. Now we could argue about now, where did that funding go to and
Yeah.
and I think listeners should understand that in endometriosis, one of the biggest issues that we fight is that the majority of research coming out about the disease is driven by the pharmaceutical company. So
Mm.
this isn't an anti-pharma conversation. It is a conversation that if the company is funding the research, it's never quite independent. And it's always going to have a little shred of motivation to find something more important or not more important. And I think in endometriosis, we would love to see microbiome research. We would love to see, so a lot of the good stuff comes out of Brazil because they fund it differently.
Mm.
And even with neuropelveology and behavioral psychologists, they have research studies on that stuff that we don't have here.
Mm-hmm.
But I think that we have an issue with this bias, and our goal is to find the research, find the work people are doing, find the patient who wants a voice so that nothing is biased. And actually, MedTech's been a blessing on that because they can get funding in different ways.
Mm. That's really good to hear. And I hear you on that. I actually did an episode on that Washington Post article on hormonal birth control and people using it, not using it. And the reality that we have to face with any kind of healthcare research is that there's, at least in the United States, and I'm going to ask you in a minute about what you're doing now and expanding internationally, but in the United States, it's always profit driven at some level. And this is because that's just how the system is set up. So, we know there's tons of research even about the research in terms of like negative studies not necessarily being published, that bias is implicit within the entire system.
Well,
So,
as somebody who's out there looking for grants, the grants literally state that you have to be using whatever drug it is to qualify for the grant. And
mm,
yet we have such a nice little program. We even offer our program in Spanish. We would love a grant,
yeah, I get it. Absolutely. Which is also tricky because it requires people with this extensive interdisciplinary knowledge and the surgeons who are more well trained to often practice outside of the system, which makes it more expensive for the individual patient. So, I don't have an answer for that, but I think it is an important thing for us to always be aware of.
Yeah, I think that that's a huge issue in endometriosis. And while for years on end, the surgical codes did not even reflect where the endometriosis was located. So if the
Mm,
endometriosis was on the tube or if the endometriosis was on your ureter, it was all coded the same.
wow.
Now we have new codes, but insurance companies aren't necessarily using them yet. So what we're seeing is that the doctor's offices are having to sue the state that they're practicing in to get reimbursement at all.
Which again takes more time and effort away from their
Right.
practice. And there certainly aren't codes from a nutritional and functional nutrition standpoint and functional medicine standpoint to dig into personalized hormonal use, microbiome, nutrition, and supplementation. Like this doesn't even exist in terms of what's recognized.
No, and that's, we with the Endometriosis Summit, of course, we do offer CME for certain parts of it. But in order to offer for nurses, nutritionists, physical therapists, you have to have research that cites every single thing. That's it. I know I see you because you offer that with your programs, but the issue becomes sometimes what we do clinically
Mhm.
is not matching what the research that's out there, because I feel like people don't want to know, or the research doesn't want like to hear about the microbiome when the drug is just shutting down your hormones regardless of what it's doing to your microbiome. They don't want to sponsor research that might be something in the contrary. And I was talking to a patient last week and they said, "Oh, you're just bitter." Like, trust me when I say this, I'm not just bitter. This
No.
is the environment.
Yeah, absolutely. And it's the environment for so many things that it's absolutely true. So, okay, so we have the Endometriosis Summit. You're on your 7th year. Your goal is to bring together an interdisciplinary conversation like this, multidisciplinary, and with people living with the disease, whether or not they are practicing also as health or wellness professionals. So, what's current? What's next for you guys? What are you doing out
We
there?
have a date. So
Mm-hmm.
we are March 25th through March 28th through the 30th, 2025. We're going
Excellent.
to get fired up. Each year we have a theme. This year we're getting fired up. Has a little bit of a Moana theme, by the way, because we're in Disney. So it's
Oh,
Moana's.
Disney.
Yeah, it's Moana's year.
Love it.
This year, past year, it was Lion King.
Okay.
So, but now, we don't go too over the overhead. But one thing that we're working on very hard is to hold a lab on neuropelveology. So
Great.
we would have open to the entire conference some lectures and some demos, and then we'll have a lab that'll be MDs and PTs. And I'm going to go out on a limb, probably say, and an integrative health practitioner. And then we'll talk about neural tension in the PT section. That'll be really cool. We also have coming up likely a social event in New York. We're headed on the world tour for Italy. We're doing a 3-hour bladder course because the bladder and endometriosis is so complex and involved. And I am actually working with the American Urological Association on their patient board. This will be our 3rd year that I'm invited to speak only to urologists about what endometriosis people want a urologist to know. Because I think if we started there, then you could go for bladder pain and actually get diagnosed versus 15 years later not understanding what your pain is. We got a lot going on and we
Yeah.
try to listen. So, if there's a topic, like already I'm obsessed with the GLP-1, we're going to talk about that after. But if there's a topic that people are craving to learn about, usually they reach out to me and I try to find that to develop that for people, because people with endometriosis have no option but to turn to something like a podcast or something like Facebook, or we have a very extensive YouTube webinar series to our conference, which we always offer in person and virtual so that you can lay in bed on a hot pack. We have no other way of getting that information.
Yeah. Yeah, absolutely. So, if people want to find out more about the conference and all of your other platform, what's the quickest link for them to go to?
www.theendometriosissummit.com. And we also have a very active Instagram at Endometriosis Summit. And we have lots of fun over there. There's a lot of this.
That's great. A lot of reels over there, a lot of
Yeah.
energy. That's great. And we'll also post all of the other links in the show notes so people can find you in the summit. And I'm so glad there's this global reach now where you're going into Brazil and finding, even better, more independent research. You're going to Italy. And as I was saying, I had a patient from Italy who really was like, there's just nothing like this here, in Europe. Like, there's more expansion that needs to happen because so many women all over the world are struggling with endometriosis.
Yeah, so we do Endo Summit Brazil now once a year. We
Great.
have Endo Summit Asia planned, which supposedly they'll give me dates for that soon. We are offering, at the request actually of our followers, we're now offering Endo Summit Spanish. So we
Mm.
do content in Spanish. Italy has a very active patient group, so they're called APE. We try to partner with them. We don't, really go in there. It'll be interesting to see because in Italy they don't have the roundup.
Right. Yes, it is very different. Yeah, it's in Italy. So one of my long-term vision board, not too long-term now, as I just turned 50, so I'm getting closer to hitting my vision board, but is to live at least part of the year in Spain, France, or Italy in the Mediterranean coast. And I've been to Italy almost every year for the past 5 years. And we took a group of our clients last year, our students, to the birthplace of the Mediterranean diet, the Cilento coast, which is still a big national park south of the Amalfi Coast. And it's very agricultural. It's, beautiful. The food is amazing. And it's so fascinating because I don't have personally endometriosis, but I do now have a pretty complicated post-viral syndrome that has a lot of similarities from an immune, microbiome, neurologic standpoint. And even before I had that, I've had some, food sensitivities and things like that. And in Italy, I can eat any food without inflammation, without pain, without digestive issues. And it's really interesting to see the shift when you're in a part of the world where these hormone disruptors and these microbiome disruptors are literally outlawed. It changes the inflammatory property of the food, of the water, because it's not leaking into the water. And so it changes I really believe that it changes that inflammatory load that we deal with day to day here.
Yeah, that's like in Canada, I can eat meat.
Mm.
I can't eat meat. Well, certain areas of Canada, it's outlawed. In BC, it's outlawed, but I can't eat. We'll see what happens. This is my first time to Italy. What happens in terms of that? But I think it also would be interesting to like in my fantasy studies to show somebody with bowel endometriosis in Italy versus somebody with bowel endometriosis. I mean, we'd have to find hundreds of patients. Can't be one person.
Sure.
Versus in the United States, because in the United States, I feel like no matter, and I work at it, no matter how hard you work at it, you're getting exposure to something.
Oh, for sure.
You
Absolutely.
can end up mentally with an eating disorder because you're so worried about that exposure.
Yes.
And it'd be interesting just to see, like, at surgery, are they more inflamed? Are they, to take each lesion to analyze it? This is my fantasy. When you live in Italy, we'll make this happen.
We will. We will. And I do think there's this difference in terms of how things are addressed. Like, for example, constipation in Italy is addressed by concentrated chicory, which is greens. It's essentially like dandelion greens. And so there's a different mindset to the kinds of ways that we focus on healing. But yeah, so I think there's a lot of questions about all of those things because globally, there's no perfect environment anymore. We do have pollution and all of those kinds of things, but certainly, Cilento, and other areas that are kind of aligned with the science of the Mediterranean diet and lifestyle, by the way, because it's not just the food, it's the time outdoors, it's the amount of walking, it's the social connectivity, but the entire Mediterranean and sort of centenarian lifestyle, you see similar kinds of things in certain parts of Asia, really impacts someone's lifelong inflammatory load without having to work so hard to the point where there is that disordered eating risk.
It was interesting in the neuropelveology course. They talked about, now for people with endometriosis, we in some ways loved the pandemic because we were home now and not, but it has changed the way people's tushies are. And so you're seeing nerve compressions and vascular compressions as I sit here slumped in my chair 6 hours a day. And in particular, that we all became Peloton fans or bike fans instead of running, that we did start to see a lot of changes in the way the vasculature and the nerves were compressed. So like sitting is not good in many, many ways. But you and I, let's sit some more because that's what our lives have become.
That's right. That's right. I mean, truly, I sit more in this job than any other, but I do now have like a little walking treadmill in my office, and now it's warm enough, even in Connecticut, to go outside all the time. So,
Wow.
yeah, but thank you so much. I think I just appreciate you and your work so much, your passion for this, and ultimately your care for every woman who is trying to find that deep care for her diagnosis and not being missed and gaslit and all of the things that you had to go through. So thank you for,
Well, thank you. Thank you for your work. I think it's the extra piece and it's one big piece of the puzzle, what you do.
yeah, thank you so much. And go check out the Endometriosis Summit. And I just love seeing how it's expanding. So wherever you are in the world, find your closest one or the virtual option, and you can listen to many of the top voices talking about a very integrative and multidisciplinary approach to endometriosis. Thank
Thank you
you.
so much.